Breast augmentation is one of the most common procedures in plastic surgery today, but that's not the only procedure. Breast reductions or breast lifts, and even a technique to combat male breast enlargement can help you achieve the look your heart desires. Dr. Hugh McLean from the McLean Clinic is here to share his expert advice to those people considering breast surgery. This is Daily Web TV. Breasts, symbols of motherhood, femininity, and sexuality. But we don't always like the ones we've got. To find out how we can enhance those ones that Mother Nature gave us, we're speaking to Dr. Hugh McLean. Dr. McLean, why do people have breast surgery? I mean, beyond the obvious.
Well, you know, there are a whole variety of reasons for breasts. Breasts are one of the most changeable organs of the body. One of my most favorite clients was very young. She was only 14 years old. And when she came to me, she had a big jacket on and she sat very hunched over, and her mother did all the talking. And her breasts were very large and they were getting attention that wasn't wanted. And she was acutely embarrassed by this. So we made them smaller, very young age to do it. But I'll tell you, when I saw this young woman come back 3 months later for her follow-up visit, she was wearing the cutest outfit, she was standing perfectly straight, and there was a big smile on her face, and the body language just said it all.
So there's obviously the psychological factor, not just the cosmetic appearance part. Now, let's talk about breast augmentation, because I gather that's probably one of your most common procedures that you perform.
It certainly is. And breast augmentation, of course, is done with implants. And the implants, as you probably know, are pretty varied these days. There's a whole process of consultation with people wanting breast augmentation, having to do with the various types of implant and where to put them and how big, of course, to make them. And while we try to satisfy everyone's expectations, one's body is limited to exactly how much it can accomplish.
So obviously you would try to create a shape or a size that is appropriate to the overall look of the human being.
It's very important to listen to that person, to try to meet their expectations, and to try to keep them normal.
Absolutely, for the best results, I imagine.
Absolutely, yeah.
Now, breast sagging, a big thing for women who've gone through childbirth and have aged. What do you do for that?
Well, breast sagging is, as you say, usually a consequence of pregnancy, but it could simply be the genetics, the way the skin is, and how much breasts respond to gravity. What we do for that, of course, is a breast lift, which is very similar to a reduction. I sort of think of sagging breast as similar to a floppy pillow. When you take that pillow and you put it into a tighter pillowcase, it becomes more firm. And that's really what we're doing. We're doing that by taking away the skin, which is really the pillowcase of the breast. We have to move the nipple into a higher position usually. And doing that, we leave it attached to the breast. And then we remove the skin, and we do this all from the bottom to kind of push the breast up. And that means that the incisions are kept where
underneath
people don't,
the fold.
Exactly, where people don't see them. And in clothes, you don't see them.
Clever. So you have breast lifts, breast augmentation, and breast reduction. Now, breast reduction, I understand, is sometimes done on men.
Absolutely. And men who have breasts can be very, very sensitive about that. Sometimes they won't even go to the gym or go swimming.
And is this something they're born with, and they basically get feminine style breasts?
Usually they develop as time goes on. Some men who use steroids, for example, for bodybuilding, develop little breasts. And sometimes it's related to weight changes, becoming more obese.
And you can correct this? We
can correct this, yes.
Now, there is one more area that not everybody deals with, but I understand at your clinic you do, and that's transgenders.
Absolutely. The patients who are genetically female, but who feel they were born in the wrong body and want to be male, we have procedures to remove their breasts and to create a male-appearing chest.
Well, great information about a fascinating subject. If you'd like more information, go to McLeanclinic.com. I'm Sheila Clark, keeping you informed, and you've been watching Daily Web TV.